Okay, let's start our presentation, that is neck pain and its management. Uh, so we have less people today, but no problem, we are online also. So my name is Mayank Khurana, and I have completed my bachelor's degree from Maharaja Agresyan Medical College, Agroha, and I have also completed my internship in Apollo Hospital, that is in Delhi, Sarita Vihar, and I'm working in JGU as a physiotherapist from 1 year. It's about 1 year actually, and so I thought to take a presentation of neck pain because this Corona times we have a lot of neck pain, a lot of work because we have a pain that is there in neck because of unusual like times we have and improper chairs and all that because we're working in the offices in a good posture actually. When we're working home, we don't see good tables, good chairs. We are lazy actually. So we'll start with this neck pain. Uh, it will be good if you just tell me your name. It will be easy for me. Just like can talk and then make an interactive class. So.
I'm Swarnima Singh. Hi, I'm Swarnima Singh and I'm working with the JGU from December 2014. So I've already completed 5.5 years of. And means I'm working with the schools international affairs. Thank you so much.
No.
Yes. My name is Sydney. I'm an assistant professor at JSLH, and it's been a year since I joined. And I've been having not just pain in my neck, but also in the lower back. Because the thing is that we are so used to standing and teaching for 2 hours, 3 hours, and we walk around a lot. And teaching has always been a very physically active job. And all of a sudden, we are on our laptops all day, staring at a screen and sitting. Even if I have like a proper, so I made sure I had a proper table and a proper chair. But despite that, I'm struggling with back issues. So I'm really hoping that this is going to be useful.
Yeah, it will be.
Hi, I'm Courtney. I work with kids and same like her. Now that we're all working from home and most of our academic work is like on computers, I start off in a very good posture, then I lean forward, then the neck goes up. So yeah, so I'm just trying to put my leg and there. As you mentioned, what's a good chair that helps?
Yes. So we'll study more about the things like we just use back posture in homes and also in the offices also. So we'll study about this neck pain. I also want to know how much hours does you work for like standing, sitting, and in the computers, in the phones, so that we can help you more. So, first from you.
Approximately on daily basis, minimum 8 hours, 10 hours in fact, or sometimes more. But what you're talking about, sorry to say like this, but I do have an idea that is the wrong posture, right? But once I'm just checking with the Excel sheet or something like that in front of my laptop and I'm just like this, right? Okay. I know, but this happens actually. So I will say once, yeah, because if I need to concentrate, so I have to be like this. Means, I should say consciously or unconsciously both. But many times unconsciously because you have to just kind of, you need to be by the deadline, you need to finish the deadline. So you need to be like that. People are aware. I'm not going to say that we are not aware, but still, we are lacking behind that and yeah, we this kind of ignorance or what it does. So I stand a bit through the day when I'm working in the kitchen, even I'm in the house a bit, but not, and I do take very long walks in the evening because I feel I need some activity. But the problem is that since I'm at home all day, so I live in JTC, other than work, talking to friends, entertainment, relaxing, everything is in a seated posture. So that's the problem. So now I've made it a point that I almost remind myself every hour to just get up and stretch. Because I'm in pain. Okay. But when I'm not in pain and I'm just going about doing my usual things, it sometimes so happens that I've been sitting almost the entire day, unless I just get up for a water break or to cook something and eat. And even when I'm eating, I'm sitting. So you get the point, right? I mean, this is not supposed to be a normal life, what it has become part.
Due to corona.
Yeah.
So it's a busy schedule and then it's gone to like.
And there's a lot of work also. So I think the stress of the work is also adding to the neck and because of the stress issue.
I think it's the same for all of us. It's approximately 8 hours on computer. Of course, now that we're working from home, it's interspersed between. So I do get up and I do yoga. So I think that helps, especially the ones that are about the back. So that does help. But it is not to say that I used to look at myself in the mirror and see that there is a crouching posture now. So the trick is to be mindful, but what else can we do? With like chair, mat support, how should we place our feet? Within the limitations of what setup that I have at home, how can I work around that? Because the moment your body acts up, then your concentration is
Okay, that's good. I just want to know what you work and how do you work. I just want to know, other than work, other than like your stressful life, you can say, and other things, how much do you do exercises? Exercises, morning, you can say yoga, or like something, you can say home exercises. Now, because you cannot go outside to this home exercises. It's said that we have to do in the morning as well as in the evening, so that muscle will be not be contracted or not be stiffened. So just want to know how do you do the exercises? Do you do the exercises or not? It should be like true. If you don't know, that's okay, no problem.
So thankfully, I managed to I started getting a treadmill right before.
Okay.
I was very lucky that way throughout the quarantine. I also got weights. So I have like a small gym. I have a trainer who sends me exercises. At first, don't finish his routine all the time. But yeah, so I get like proper workout and I've been a regular working out for the last 3 years. So there is considerable muscle strength. In the mornings I do yoga and then some workout and the rest I do in the evening when I take like a 1 hour walk. And then I come back and finish it up with some exercises, some exercises. So yeah, I do manage to get exercises.
That's good.
I don't think I exercise much. I go for a run maybe twice a week, a half-an-hour run, and I walk every day. Yesterday I walked for 2 hours. So I have a friend who walks with me and he walks really fast.
Okay.
But that's about it. And I used to do some strength training earlier at home, but now what I'm feeling is that my lower back is hurting, so I don't want to do anything in the wrong posture. So if I lift weights or do squats in the wrong posture, or even in the right posture, if my lower back is already hurting, I don't want to hurt it further, which is why I sort of eased up on that front for now.
Because if you do the wrong posture squatting, it will lead to a.
I don't have a mirror. I want to do planks, but I don't have a mirror to ensure that I have the right form. Yes.
Because it can lead to muscle injury, again muscle injury, then it will take to heal again, and then again will be there.
Yes,
So it's
so
better
that's not really.
it's better to do like first the healing of your muscles, back pain, and then doing the exercise. Rather doing like a lot of people do ignore the back pain and then do the exercises, and then they come to us to treat us in 1 day. That's the.
On daily basis, I'm doing yoga. Apart from yoga, I'm doing brisk walk also. I prefer. Earlier also, I used to go to gym and all, but just because of this corona and all stuff. So exercise is not a problem. I'm a bit aware about the postures and all, but sometimes it happens like a couple of days back while I'm sleeping. I'm using the memory pillow also, but then again, if I posture, I'm usually having pain. That is the thing actually. So what we need to do related with all, like this is, we do have some expectations once we are just going to attend any kind of, this kind of workshop. So I hope it will be helpful.
Yes.
Thank you.
For sure. So I'm a physiotherapist. So I just want to know from you, like we know about doctors, and doctors give us medicine, they do surgery. I think a lot of people doesn't know about physiotherapy. So what is physiotherapy? I just want to know just a points from you. No worries if you don't know. I will tell you what is physiotherapy. Just I want to know from you what is physiotherapy, because a lot of people don't have that knowledge about it. What the physiotherapy does? Why do we go to the physiotherapy? Why don't we take a medicine from a doctor in a neck pain? Because a lot of people thinks we can go to doctor and buy a medicine, 2 to 3 rupees medicine. We will take it for 3 days, like BD, once in the morning, once in the evening, and 3 days the pain will go on. But pain will go off. I'm sure for that. Pain will go off, but it can come again because medicine only cures the pain. Physiotherapist cures the pain from the root. They give you exercises, they give you treatment, they give you good posture, and also they give you some exercises that helps you a long time. So just want to know, what do you do for physiotherapy?
That's you already really talked with the physiotherapy with the your physical body, right? So if anything happens, it's a muscular pain, it's a joint pain, it's a bone pain, you will know because you definitely you're specialized in that. So you can just tell us just don't bend your knees or don't bend yourself like this. It's a good wrong posture, it's a good posture. What's the it's a muscle pain, so how you need to this tell means otherwise we are just going to say okay, it's just a simple pain. My elbow is paining. Okay, I just take away the medicine. Obviously, it for the time being it's because we want to give you a relax for time being. Again, it will occur because root is still there. You need means physiotherapists know about everything and then you people just check it's a swelling, inflammation is why, for what the reason. And then as for that, this instructors, okay, that's okay. But I
Very good answer actually. I'm not expecting this. Thank you very much.
So I really don't have very much to add to what is said, but I have some experience with physiotherapy before. I've had some because I was facing some knee pain, and I know a lot of people who have greatly benefited from physiotherapy. So also people who have certain autoimmune diseases who have to do physiotherapy regularly, and it's the only thing which keeps them in track in some sense. Nothing else works. So I understand that it's very important, and like you said, it's like a lifetime solution. And it has to be done lifetime, and not just as long as the pain exists.
Yes.
So, which is what physiotherapists say. Yeah.
Same. My dad has sciatica, which is something that happens with age, but also I've noticed a couple of my young friends have it. So it's just a back issue thing where that prevents people to like it improves your limb and it works a lot. And it's like always there, pain, and I've seen him suffer. And both the diagnosis was late and also like the pain meds didn't help, but what really helped, of course, gradually with practice was physiotherapy. So I have the same experience of like watching that. As far as I understand, it works with the muscle of the body and more like recalibrating what we have harmed our body in certain ways, just like undoing that and recalibrating it in a way that it's more sustainable as a machine. Yeah.
So you all have given a very good thing about physiotherapy. Actually, physiotherapy, its word says physical and therapy. Therapy that is given by hands, physical means, not by the using drugs. And in physiotherapy, there is a lot of branches like urology, orthopedics or orthopedic, sports, geriatrics. That is for kids and geriatrics for older people. So we have a lot of branches in physiotherapy. So physiotherapy mainly concern about rehabilitation of the patient from where the patient starts. Like patient have gone from fracture, have gone fracture, and then doctor rehabilitate him. The main purpose of physiotherapy is to like he can walk and he can just achieve his life as he was acquiring it like he was doing like in his past like, before fracture. So physiotherapy is only a rehabilitation process. It takes time because if you get injury like neck pain, People tell us like we have a neck pain and we need a solution within 3 days. But muscle needs a time to just heal up. We can do some exercises, some hot therapy, cold therapy, but it takes time. So it takes around muscle to heal. It's 1 mm per day. So when a muscle gets injured, it takes time to heal. So yes, I must say physiotherapy is like it takes time, but it is very good therapy instead of using drugs and all. So let's start with neck pain and its management. So this is neck anatomy, just neck anatomy. However, neck usually looks like. So this is the anterior part. Okay, we cannot see it here.
Yeah.
Okay, so this is the anterior part of the neck, and this is the posterior part, like from the back, or we can say this is the front part and this is the back part. So in the front part, you can see our skull. This is ribs. So this is ribs, all the muscles, and this is skull, and this is also the muscle. The main pain comes over here. This is the muscle. This is the muscle called trapezius, and it hurts more in the back pain, in the low back, sorry, in the cervical pain. And this is another backside of your neck. This is the muscle. Again, the muscle. You can see that the spine cord, as well as the cervical spine, thoracic spine, and lumbar spine. So you can see over here shoulders, here the muscles. Okay. So neck anatomy. Just briefing it. Neck is made up of vertebra that extend from the skull to the torso. The bones, ligaments, and muscle of the neck support the head to allow motion. The bones which support the neck are called cervical vertebra. Cervical vertebra are 7 vertebrae, and the cervical disc. In between that cervical, then the cervical is there. So this is like this cervical, and this C1, and this is C2. So in between this, there is a disc, or we can say it's a synovial fluid, which helps the body or that cervical body to move. Like we just move like this, it helps to move. So this is called cervical disc, which absorbs the shock from that boost. When you just move it, if it get like more, it just absorbs the shock. So this is, you can see this. This red one is cervical. C1, C2, C3, C4, C5, C6, C7. And from G1 to G12, that is thoracic spine. And L1 to L5, that is lumbar spine, where you get the pain. Like you have said, you get a lower back pain. This is the L1 from that pain. From basically this pain arises L4 to L5. And in neck pain, we get around C4 to C7. Upper, we also get the upper pain in C1, C3, but the most common pain is from C4 to C7. So, what is neck pain? Neck pain is also known as cervical GR, and it is a sensation of discomfort in the neck area. It is a common complaint of the patients. Approximately 2/3 of the world population suffer from an episode of the neck pain at any time. Many people experience neck pain and stiffness occasionally. Like when you get neck pain, there will be a muscle stiffness in your muscles. It will tight actually. So when you feel it, you will feel it tight and warm in that surface. When it touches the surface of another part, it will cold than the other part. Like it will be hotter. So neck pain isn't a serious condition and can be revived within few days. Neck pain is common among young adults, but can occur at any age. Symptoms. So, how does the neck pain occur, or what is the symptoms of it? So, pain that is often worse by holding head in one place for a longer period of time, such as driving, working on a computer. The main symptom is this only. When you work on a computer, like holding your neck, it causes neck pain. And when you feel the tenderness is there, you can feel the neck pain. Swelling in the neck region might be sometimes present sometimes. We will feel the swelling and muscle tightness, muscle spasm, as I've said. Decreased ability to doing neck movements. When you have a neck pain or a neck spasm, you cannot move your neck till here. When you come to doctor, you say, I cannot move my neck because that neck spasm creates a contraction of the muscles, and that part hurts very much. So that joint cannot move. And also the headache. A lot of people faces headache that leads to neck pain. Pain related to arms from one side to the both sides. Like people also feel they have a neck pain and they say they have a pain in hand. It's because of compression. Because we have a muscle like this, and in between the muscle the nerve goes on. The nerve compresses, and then the nerve compresses that also have the nerve, the neck also have the nerve related to the, you can say, branches to the hands. That nerve compresses. That's why the nerves pain we have. Neck to the relate towards the hands. So when to see your doctor? If this symptom persists for more than a week, consult doctor. You should also see a doctor if you have severe neck pain, headache, nausea, breathing difficulty, numbness, numbness, tingling. Because numbness is also occurred because of nerve compression. So tingling sensation also because of nerve compression. You feel tingling sensation over here, numbness over here, numbness over here. So pain that radiates down to your arms and legs, inability to move your arms and hands, inability to touch your chin towards your chest like this. Cannot touch it. So you have a pain over there. Okay, risk factors, age above 40. Because when we see above 40 years of age, we do not have, like, we have insufficient number of calcium, vitamins, it causes pain. And maybe due to coexisting low back pain. Because of low back pain, you can have a cervical pain. Because low back pain have that muscle is attached. But we have seen in the first slide, all the muscles attached towards that cervical. When we have a when we have a back pain, that in that muscle, we see low back muscle is contracted. When it is contracted, when it is hurting, the upper muscle also being contracted. So it causes neck pain also. Smoking can lead to neck pain because when we smoke, our muscle is contracted over this neck muscles. Occupation, job with lots of repetitive neck motions and overhead work. Like this you do, that's right. Depression and anxiety. So we have depression also, anxiety also, like we have a stress in the life of doing work and all. And poor quality life, like lazy, we are lazy, don't do exercises, we are still in the same room, don't do the exercises, don't go anywhere. So it's a poor quality of life. Decreased vitality and previous injury or trauma, like if you had a fracture or some other injuries. So causes of neck pain: inappropriate posture, bad sleeping posture, injury in neck, arthritis because of old age, and psychological stress and miscellaneous causes. So what is posture? Because posture is defined as the way in which someone usually holds the shoulders, neck, and back, or particular position where someone stands and sits. It is known as posture. There are two types of posture. That is, one is static posture and second is dynamic posture. Static posture is like when you hold yourself while moving, in standing and sitting, and in dynamic when you hold yourself while running, walking, etc., or bending. It's a dynamic posture. So this is bad sleeping posture. We always face this thing. Sleeping in a regular surface can lead to stiffness and pain. Sore neck is likely due to sleeping in odd positions or holding your neck at any angle that stresses the muscles and tendons at that side. So when you sleep, I think a lot of people sleep in irregular position. We cannot maintain that position, right? We can just do things like we can take soft pillow. Don't take too high or stiff pillow while sleeping can lead to morning pain, muscle stiffness. And if you ask me like how much it should be like soft or it should be thin, it should be comfortable to you. Because if I say like it should be very soft and very thin, you won't be able to sleep because you're sleeping in a long thick pillow. Like, so you can take like we can start by decreasing it day by day. It will help you because when we sleep, the neck always with the pillow, the neck always do like this. So where the neck is like this, the muscle that is attaching over the back side it is contracted. And when you just wake up, it is contracted and you feel the pain. That's why it's morning soreness.
I'm sorry, to say, but can I ask you one
Yes,
thing?
yes, please, please. No problem.
Like they are saying, like some person through by few researchers, they are saying like pillows are not good.
Right.
And apart from that, on contrary basis, they're saying no. Now the memory pillows are really good. So what is your experience observation related to
If I say you like don't use pillow, that won't be like you will say
the practical
yes, you will say no sir, we will use the pillow, we won't be able to sleep. So it is good that you don't take pillow. It is said like if you don't take pillow, you will have a cervical, you will have a pain, you will have like in old age you will feel a lot of pain, you have to go for a surgery. It's better to take a thin pillow which supports. I will tell you how the pillow you can support your pillow, like from your head towards your neck, either like in your shoulder. Take the pillow like this. You don't feel a pain because when you take the pillow, it's on your head like this. So your neck gets elevated. So you have to take your pillow towards your shoulder also. Towards your shoulder also. So it will help you. And a lot of people say you can take cervical pillow. A lot of people say you can take different type of
yeah,
mattresses.
different memory pillows.
Yes,
But it's not
different type of pillows. You can take any pillow you want. The pillow gives you comfortable, and the pillow gives you sleep. That's more important. If I say you just buy a fur pillow, buy it and you will have you don't have a neck pain. That's not possible. Because when you're not able to sleep, that's you don't like the pillow is waste of that money. You're wasting your money. It's better. You can take a thin pillow or decrease day by day. Take a thin pillow and take it from your head towards your shoulder. It will help you more. We can change the posture. We don't have to change your lifestyle. If you change your lifestyle, you won't be able to like sleep, survive.
Is there like a general recommendation about good sleeping posture? Because I mean, I understand about the pillows. For example, I don't really use a pillow when I'm on my back. But very often I'm not on my back, I'm on my side. So is there a standard recommendation of what good sleeping posture entails?
Sleeping best posture is on your back. On your back. But a lot of people try it like on their chest. They sleep on their chest because when we work a lot, so our back muscles gets taut. We cannot sleep on the back. A lot of people sleep on their chest so that they have that first sleep on the back. You can sleep on the back.
What is on the side?
You can sleep on the side, but like when you wake up, when you sleep like this, so you will have a stiffness in your hands, and when you wake up, you will feel a pain in your hands also because it is the nerve is compressed. If you see like this, and your whole body weight is on the one shoulder, you are compressing your nerve.
So on the back is the advice.
It is a back is a it is a best, but a lot of people say we can sleep on the back, but we don't know when we wake up we are not on the back. We cannot. I say that we cannot manage our sleep. We can manage our posture. We can do exercises. We can improve our muscle strength. Instead of doing this, we can improve our muscle strength. We can improve exercises, and we can improve our posture doing sitting and sleep, standing. It will be more helpful to you. So this is the posture that is more effective to like using computer, using laptops, using phone. It is known as forward neck posture. So forward neck posture is known as plunge, also known as forward neck posture, computer neck, and poking chin posture. It is the commonest spinal problem that may lead to the pain in neck, muscle stiffness, and headaches. There is a muscle weakness and muscle stiffness on back side of the neck with overactivity of muscles in front side of the neck. So it is very easy. Uh, so this is your neck. This is your neck, and if we make up this thing, this is the neck. This is the front muscle, and this is the back muscle. This is a normal individual. What happens in we can say in forward position, forward posture. So this is the neck. Forward posture happens like this. This is whole the neck is stretched like this. So this muscle is like this, and this is like this. So we do it like this, this. So our neck muscles are stretched like this, or we can say so it's stretched in front. So when it is stretched in front, the muscle will be like taut, it will be taut muscle, and the front muscle will be taut, and the back muscle will be like less. This is it is written. The back side of the neck will be stiff, and overactivity of the front muscle. So for the forward neck posture, we have certain exercises, and if you have like, how do you know that you have a forward neck? You can stand beside the wall and check how do you like when you see you have a space in between or not. If you have a space, then it's forward neck. Or like you can stand in front of the glass, you can see it. If you have a neck like this, it's normal. If you have your forward neck, it will show on your glass. So this portion is very painful. Uh, I will tell you some exercises. It will help you for your forward neck. So this is forward neck posture. As you can see, this is a normal and this is forward. As you can see the stretch of that muscle. It's because due to using laptops and smartphones. So injury in neck. So we use cars and all. So we get an injury called whiplash injury. When we drive a car and we get an accident. So due to fall from height, car accidents, whiplash injury, and sports can lead to injury in neck. When we play sports, football, cricket, we get a neck injury. So overuse such as too many hours hunched over your computer or smartphone often trigger muscle strains and even minor things, such as reading in bed, reading a tree, and can strain your neck muscles. Lifting heavy weights from your neck. Like women always lift heavy bags on their shoulder. It can lead to neck pain. Like you have lifted this bag from like this, you will have a pain in your shoulder. That shoulder pain can lead to neck pain. So it's better to not to lift bag. You can just carry your bag like this instead of lifting like this. So heavy bag can lift, or you can take a bag of this both shoulders, both your shoulders. So this is whiplash injury, how it occur and how it does look like. So when your head is forcefully and quickly thrown backward and then forward, commonly known as whiplash injury. It's like occur in like car accident. This motion can injury bones and spine, disc between the bones, ligaments, muscles, nerves, and other tissues of the neck. Whiplash injury can also occur from sports accidents and other types of trauma like fall. So this is whiplash injury, how it occur and how it injure the disc between that. This is the ligaments, this white one, this is a joint capsule, and this is disc. So when we get a like this injury, we get this type of ligament injury. we have a ligament and it gets injured like this. So how's your posture? So we can see this posture. So this female have a forward neck and this low back, sway back position. This is the normal. So we have a benefits of great posture that prevents muscular and back pain, increase lung capacity, improve performance, improve relaxation, work out better, increase core stability. If we have a better core, we don't have a back pain. We say like it's not my topic today because I will take a topic again like for a back pain also. I will make a video slide for that. So it's just a hint for you. Like when you have a back pain, it always refers to you have a bad core. If you have a bad core, you will have for sure you have a back pain. Because then when the muscle, because when your core is heavy, like core is there, core is heavy, your back muscle gets stretched. When your back muscle is stretched, it causes pain. So when your core is good, you don't have back pain. So decrease joint wear and tear. It also decreases the sprain and muscle balance, looks younger, promotes best appearance, and also increases the confidence. You can see the confidence of this girl and this. So what we can do for a good posture? Be mindful of your posture during everyday activities like watching television. Don't watch television like this. Just be appropriate. And washing dishes, like when you wash your dish, you have to wash like this. Like we get tired and we do like this. So that's a bad posture. And walking. When we do walk, a lot of people do walk like this. Like we don't want to walk and like stuff like that. You should be walk. If you want to walk, you have to walk like completely in a stand position, like that, erect position. If you don't want to walk, just sit for some time, and then you can walk. And okay, maintain a healthy weight. If your weight is more, you will have a back pain, you have a muscle pain, because your weight of the body affects the down of your ankles as well as the upper one. Make sure work surfaces at a comfort height for you. Make sitting in front of computer, making dinner and eating meal. Okay. So when you use your computer, always try that your shoulder should be at the level of your computer. And if the computer is down, you should increase the height. If it is height, so you can decrease the height. So if you like while sitting and while standing, you have to make a good posture for it. So when you like sitting in the chair, like we are sitting in the chair, and this is decreased height, and I'm using like this. This is a wrong posture. I should sit up straight, and it should be exactly parallel to my shoulder. It doesn't hurt. If like you feel like pain, like you're just doing like this and you feel pain, you can just apply books beneath it or something like that heavy like height surface and put it over here and you can use like this. But your shoulder should be right. If your shoulder is like down, you will feel back pain, neck pain, always you will feel neck pain. But like for when you do for 3 days, you will for sure you will feel pain because your muscle is erect. Because your muscle is tightened. So when you do like this, it will help you. So a lot of people have a psychological pain also. Stress due to some work and increased mental workload can cause extra shoulder tension. Angry or pride can create tension that result to the shoulder neck pain. Like so psychological pain, people also have like due to stress, due to some other depression, they feel neck pain. The neck pain, they don't have neck pain, but they have this symptoms. So first we have to maintain the symptoms, they have to decrease the symptoms, and then they can treat the neck pain also. If they treat neck pain, then this neck pain will not go off. So miscellaneous causes, wearing heavy necklaces. Women always wear heavy necklaces and then after that they go to the party and then come back, they feel their neck pain. Less water intake. People always drink less water. Uh, if you feel neck pain and as well as low back pain, you always drink less water. You should drink appropriate exactly 4 liters per day. If you drink 4 liters, you never get the pain. Muscle weakness. If you have a muscle weakness, then you will have a pain. I have told you earlier also. So morning stiffness because you sleep like I have told you proper sleep in appropriate posture. Sports injury. If you play sports, then it can lead to injuries also. Others. Osteoporosis. It's a disease which can lead to like weakened bones and lead to small fractures. And rheumatoid arthritis (RA) causes pain and swelling in the joints. It can lead to swelling and joints and bone spurs. And in the below that is meningitis. It is basically it is a disease of the brain that causes neck pain. So I've included all the things. So here we come with the treatment. The treatment is just like a conservative treatment, we can say. I have not included any surgical treatment. It's all the treatment is basically a physiotherapy treatment. So what to do when you have a neck pain? When you feel neck pain, what you do? Apply heat or ice. You have, can you tell me what you will apply? Heat or ice? Like when you go home from now, you feel a pain. You don't have a pain from like from today. You have a pain from now. Like you don't have a pain in the past. You have pain from now after the class. What you will apply? Heat or ice?
Does it depend on what caused it? Maybe a muscle issue or like it's not a needed cold body, it will be done.
Like from like you go to the home and you feel like pain, and you have two choices. What to
Mostly,
heat
I
or
think
cold?
it's mostly. I think it's I get the pain from the muscles, so these muscles. So heat.
Heat. Okay.
Yeah, mostly it's actually right there. But I feel because traditionally we used to do like this. Since it's a muscle pain or something like that, we put something, hot water bottle or something like that. And if it's something related with the bone or something, as per the doctor's instruction, only we are going to put this ice. Mostly that it means traditionally what we people are following. This is what.
In ice first, because it says there.
Okay.
I just try to.
Okay. Okay. So there's two things. When you have, I have told you like when you go from here and you have a neck pain, you don't have a pain in the past. It's called acute pain and it's called chronic pain. Acute pain when the injury got like get in 1 or 3 days, and chronic pain when the pain there for at least from 6 days to 12 days or more. Uh, so in acute pain, we always apply ice, whether it is injury in the muscles, whether it is injury in the bones. You have an acute pain. Whenever the injury, like I get fall here, I will apply ice. If you apply hot, what will happen? I will tell you. Like if you get neck pain now, and if you apply hot pack, I have told you in the earlier thing that muscle will be hot and muscle will be stiff. And if you apply hot pack in the acute times, you will feel more pain. That's the basic and thing. If you apply hot, you will feel like your pain is gone, but pain will come again with a lot of stiffness and swelling because you have applied hot pack. It's better to apply in acute times. We apply cold, and cold should be applied for 12 minutes with a towel, not or like directly on the skin surface. If you apply this on the directly on the skin surface, it can lead to burn, also known as chills, and it will take time to heal. Then you cannot apply ice again, and then 3 days will be gone. It's better to apply ice pack in a covered like with a covered towel for 12 minutes. And a lot of people say like will apply one time, it will go off. No. You have to apply at least for 3 to 4 times a day. And if you have time, you can apply every 2 hours for 12 minutes. And in chronic times, you have to apply hot pack. What does the hot pack does? It increases the blood flow over the muscles. When you have a stiffness, when you have a pain in chronic times, it will heal up, and it also promotes healing faster of the muscles. So we can read it once. Heat therapy opens the blood vessels, which increases the blood flow, relaxes muscles, and helps alleviating pain. When to use it? Heat is the great way to help loosen your stiff joints and tight muscles. It is good method for pain relief for tension headaches and other chronic conditions. Always wait 40 to 72 hours after an injury before considering heat therapy. When in doubt, use ice. Safety tips: treat for no longer than 20 minutes. But if you like in India, if you just apply ice, it depends how the ice is. If you apply more than, like it is written that 20 minutes. So how the ice you're using? So I just recommend you have to apply only for 12 minutes, because after 12 minutes it can lead to burn. So when you a lot of people apply ice, they apply it and then they remove it. Don't do that. You have to apply it continuously. Like if you apply it, like when you apply it, and you have to remove after 12 minutes. You cannot remove like you have applied, oh it's burning, like I will remove it. For 4 minutes it will burn. It's sure it will be burn, because it is a psychological. Basically, it will burn if you apply on the skin. So you have to apply it for 12 minutes, and you can remove it. If you are not sure that it can lead to burn, or you have a sensitive skin, you can just check every after 5 minutes. You apply it and you can check it after every 5 minutes. So do not lie on the hot pack to avoid falling asleep and potentially burning yourself. Uh, Whenever you apply hot pack, don't try to sleep. Actually, you feel sleepy when you apply hot pack. So try don't to sleep, because it can lead to burns. And do not use heat if you have no feeling that affected body part. If that body part is numb, don't apply it, because it can lead to burn. And after heat and ice, after 12 minutes, you will feel numb over that part. So don't worry for that. Just check for the burns. Okay, so you can wait, as it is written, you can wait 1 hour between the heat treatments, and don't apply if you have diabetes. If you have diabetes, don't apply it. You can apply it for like 1 time, 2 times, but try to avoid it. And what is ice? Cold therapy slows down the blood flow to an injury, which reduces swelling and inflammation and pain. When to use it? Ice should be used right after an injury or an activity that aggravates a chronic condition. Ice is good for migraine headaches, bumps, sprains, and strains that may occur with sports, slips, falls, and lifting. When you go for sports, you feel pain in your legs, pain in your back, pain in your shoulders, hands. That pain is called DOMS, delayed onset muscle soreness. It occurs because of the injury of that muscles. So we can apply ice pack on that area. So it will help you from that healing part in the strains and strains. Cold therapy is also beneficial for minor burns by applying cold water from the faucet. When in doubt, use ice. Whenever you doubt for the like for hot and ice, just apply ice first. Whenever you feel pain, like from 3 days, from 4 days, 5 days, you're ignoring your pain. Just start with ice. Don't go directly on the hot pack. If you go for hot pack, neck pain can lead to, like it will require you will get relief from your neck pain at least from like I think 3 to 4 weeks. It will take. It's better to apply ice first. And how many days you have to apply ice? At least for 3 days. If you apply 3 days icing, that's okay. After that, we can apply hot pack. Okay. Safety tips. Treat for no longer than 20 minutes at a time. During treatment, check every skin for check skin every 5 minutes to make sure that there's no burns or like freeze burns and skin burns. And we don't apply ice and ice pack directly on the skin or a thin towel, like apply on a thin towel. Wait 1 hour before cold treatments. Okay. No, no, no problem.
You circulate the.
Yeah, I will see the.
Thank you so much.
Okay, you can take this. This is the exercise protocol. No problem. This is exercise protocol. I can help you with that. No problem. So you cannot do this, but you can do one thing. I will teach you something. This is called soft tissue manipulation. That helps us your muscle to relax and reduces pain and stiffness. Whenever you have a pain, like acute pain or chronic pain, you apply hot and cold. Again, acute you will apply cold, and chronic you will apply hot. So whenever you apply it, after 12 minutes, you can do this thing by using your hands and your neck. It's just a type of massage, you can say. Uh, you have to do it like this. You have to just make your hands over here, and not from the upwards. You can do from low to up. If you do low to up, you will feel pain because muscle that is attached over here to here, doesn't have any drainage because you have a swelling over there, you have a pain over there. You don't have a drainage upwards. So always you have to do like from here to here and till here because there is a drainage over here and the swelling and the pain will drain over here and you will feel less pain. The pain will be gone. So after, don't do it before icing a hot pack. If you do it, it will get stiffness will come. And you can use it this method like when you cannot go to a doctor or not go to the physiotherapist. It's better to avoid it and apply ice and heat because I think if you do it, it can lead to stiffness also. So if you cannot contact a doctor or physiotherapist, you can use this method. If you can contact, then you can come in the health center. I'm there, and other person is also there, so they can help you more. But if you feel the pain more, you can do this. And pressure should be low because this is cervical, and it can lead to damage also your brain cells and all that. Because the neck is very precious. So this is electrotherapy. What we use is in the health center. This is IFT. IFT for you, you have a back pain. It can decrease your pain because this therapy also have a like it doesn't use current because it's like current. Uh, it's a it's a good machine for back pain. It just gives you sensation of a current, but it is not a sensation of that current. It is just we can see that on your back the end is moving, a vibration sensation, and you can see a suction over there. So it reduces the pain and swelling. We always apply it for the back pain after cold and hot. So it decreases the pain for a lot of people. So another machine is we can apply this on neck pain, but it is like I avoid it because I don't apply it because neck is precious and we don't know about the neck. If the nerve compresses, then it can lead to headache also. So it's better to apply in the lower back because muscles is more on the lower back as compared to upper back. So we can. This is the ultrasound machine. This is not that ultrasound machine we use in doctors use. This is a therapeutic ultrasound. It is used for the it is used by a cold gel and for decrease the painful area and rub over the skin and send the high energy sound waves beneath the surface and the tissues. This high energy you cannot feel it, but the machine always vibrates. The machine that this head transducer is known as transducer, also known as head. When you apply it on the gel and when you apply it, it is also used in the strains, muscles injuries. You can use on this on the neck part. It is very effective and it decreases the pain.
These machines are of two types, I heard. Uh, One is for the sports injury, we also
Yes,
and
yes,
one is for
yes.
the other.
We basically are today before it used to be two machines,
Yes.
but this is now only one machine because as you can see, this is 1 hertz and this is 3 hertz. it should like in earlier day it is that the machine is two types, 1 month and 3 months. Now the machine is not like full of one thing. You can apply on the sports injuries too, neck injuries too, and always on the like low back injuries. You can apply on that. It will really helpful for that. It only does that healing your muscles. It helps in healing your muscles, promoting healing. So this is the treatment of the neck. We will do some exercises. I have a copy for you. So for the forward neck, I've told you about the forward neck. This is the best exercise you can do whenever you have a time and whenever you are driving. Because when you drive, you always drive like this. So this is a forward neck posture, and this forward neck posture affects you, and it causes the neck pain. So you can do this. This is called chin tucking. The proper way to do it like this. You can just hold your chin, and this hand should be back, and just hold it for 10 seconds, and then let it. You can do it for 3 times. So I will just share with you. So on the first page, you can see range of exercises. So as range of motion exercises. Uh, the first is flexion. Flexion is that forward bending. So when we have a pain, we cannot do forward bending. So it is recommended to do these exercises. In acute times, if you feel the pain of any exercises, like you are doing this exercises that I have recommended, if you feel any exercise, if you feel pain in any exercise, you don't have to do it. You just avoid the exercises, or you can just call me, or you can visit the health center. But this is the basic exercises for the neck pain. So this is the flexion exercises, first exercises. So you can do it like this and hold it for 10 seconds, and then you can come up. This is the basic range of motion exercises. It will increase your range of the neck and decrease your pain. Second exercise is extension, looking back. You can go back and hold for 10 seconds and then come on your proper position. If you feel like a headache or nausea when doing this, just avoid it. Just you have to, if you can do this 10 seconds, it's okay. If you cannot do it for 5 seconds. It will help your neck to get relief.
प्रोग्राम नहीं देख रहे
And second exercise is for your trapezius, the main muscle that causes your back neck pain. So we can do this exercise, one hand back and one hand on your head, like this. Posture should be like this. We can do it, no problem. We can interact, yes. Yeah, on the chair. We can do on the chair, no problem. Yeah, because when you're working on your computer, or when you're working on the office, you cannot stand up. You will
Very
know.
true. Yeah, everybody.
So you can do on your chair. Just come forward on the chair and one hand back and one on your neck. Okay? And then just stretch it. When you feel the stretch, just count for 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Normal. Do it for like you can just relax for 5 seconds and then you can go for the another neck. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And then back. So you have to do at least 3 times this side and 3 times this side. But your body should be erect posture. You should not be doing like this. Not doing like this, you should be erect. Like this and this. You should be erect. If you're not erect, it can lead to injury. And you will come to me like you have teaching us exercises and that lead to another injury. So it's better to like do these exercises. So this is called upper trapezius exercises, or you can say neck exercises, or you can say ears to your shoulders. This exercise, right?
I have a question.
Yes.
What is the difference between the upper trap and the side bend in terms of how it should feel and
Okay.
because these are two different,
Yes,
distinctly different
yes,
exercises,
yes.
right?
This four exercises, 1, 2, 3, 4. This is active range of movement exercises. Like you are not doing anything, you're not stretching it, you're just increasing the strength of that muscles, trapezius muscles as well as neck muscles. So when you are doing this and this is stretching exercise, and this neck side bending, this is like this, and you're doing this. You're just not stretching it, not providing any resistance towards your neck. You're just increasing your neck
It's
because
just a tilt as opposed to a stretch.
yes, this is stretch. This is the new exercise. This is the stretch. If you do this, because whenever you feel neck pain, you cannot do this, this, and this. So this to increase the range of motion. So side bend we can do like this. Okay, we'll sit here and we can do like this and hold for 10 seconds. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. So when you go like this slowly, and when you come back slowly, because it's your neck, not my neck. So we have to be comfortable and take precaution also. So we can bend over here also. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. So fifth exercise is levator scapulae. So it's another muscle that leads to tightness and also causes neck pain. So this muscle always be like this. Trapezius is this muscle, and levator scapulae is over here. So if you do the exercises, you will feel the pain first. You will feel the pain when you do this exercise. But don't worry, if you feel the stretch, like if you feel the pain, you can you can put less stretch on that part or less resistance. So we'll do this exercise. One hand back and nose towards your armpits. When I say nose to your armpits, it should be like this. So you can just put it over here. Your hand should be here. Hand should be here. Yeah. Hand like this. And
Yeah, sure.
so it's like this.
Okay. Over here. Oh, okay.
Yeah. And like this. And feel the stretch over here.
Yeah.
Okay. So it will be painful for you first time, but don't worry, it will help you. So one hand back and nose to your armpits and this. If you feel more pain, just decrease the resistance of your hand. We can, when you feel the stretch, just count for 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Then another side. Hand back, nose to your armpits, and then stretch. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Are you okay? Like, if you want, you can remove your mask if you want, because you cannot breathe and all. Don't worry, we are all safe. So whenever you do this exercise, just remove your mask. Don't wear the mask because it can lead to like breathing problems, and you will have a headache also. It's better to remove mask and do the exercises. And every exercise you have to do 3 times here and 3 times there, and hold for 10 seconds. So it's whenever you apply hot pack or cold pack, you have to do these exercises, and I will recommend this exercise at least for 3 times a day. It will really help you. Do it for week, at least for a week, 3 times a day, and then tell me how's your pain and how do you like it or not.
3 times in one stretch or split?
No, no, you can do in morning, evening, and in the night. Whenever you have a time, like this said, in the morning when you wake up, you can do this, and in the evening, and when you before you sleep, you can do this exercise. It will help you for the morning stiffness. Whenever you feel the morning stiffness, it will not come. So sixth exercise is the rotation. As I've said you, like when you feel the neck pain, you cannot do the rotation exercises. So we'll do the rotation first. So rotation towards left as well as right. So just be slow towards your neck and you do it like this. Hold for 10 seconds. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And then back. Then again here. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. If you feel pain in any like moving here and there, you can just decrease your range of motion. Like if you feel like I can do this, but if I feel pain, I can just decrease my range. But decreasing range is not like every time. You have to increase your range every time. If you can go like this, you have to increase day by day. You cannot do the same exercise daily. So this is the first exercise, and I have teach you range of motion exercises and neck stretching exercises. One is this neck stretching, and this, and goes to your arm raise. Third is called static neck exercises, which increases your muscles, overall muscles, back extensors muscles, and your front extensor muscles. So static neck exercises. If you feel pain or if you feel like headache, just avoid these exercises. It can also feel pain. So you can sit, I will stand. So what you have to do, you have to apply resistance to your head inward, like backward, and your head towards forward. So apply it. You feel the contraction on your back, like back muscles. So just do it. Like when you feel the contraction on your back of the muscles, start counting 10, 1, 2, 3, 4, 5, 6, 7, 8, 9, and then 10, then release. It is easy exercises, but if you do like overall all the exercises, your neck will be like tightened, like you will feel warm. You have the strength of that God's strength. So second exercise, you have to just place your hand above the ear, and same thing. You have to just push your neck head towards the hand and hand towards your head, like this. So you don't have to tilt your head. You just straight and this. You have to feel the contraction of your muscles. When you feel the contractions, just count for 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, and then release it. This is 1, this is 2, this is 3, and this is the back one. So apply back resistance. So push your head towards back and hand toward front. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, and then force. So if you count like 1, 2, 3, 4, 5, don't count like the 1, 2, 3, 4, 5, 6, 7, 10. Don't do like this. Just be slow. If you do slow exercises, lot of people say we will do fast exercises. A lot of people say we will do slow exercises. What is the benefit of the two things? If you do speed exercises or if you do exercises in speed way, it will increase your muscle for sure, no problem for that. But the small muscle fibers doesn't grow up. So you have to do both the exercises. If you do like slow exercises, the muscle injury will be less as compared to like if you do speed exercises. So do slow exercises whenever you do slow. Don't speed up. If you do speed up, if you do speed up in exercises, it can lead to injuries. And hamper your.
मेरा पेट में रहा था.
So as you can see that this is setting and exercises on that second one. This is setting exercises. This one. Which I have taught you.
Like the you have joined meeting that's being recording intervals. You are joined and then सबसे positive. क्या है?
So this is static exercises, second one. And this is that this exercise is for limited scapulae, which I taught you like ear to your armpits. And this is called shoulder shrugging. This is the best exercises for your shoulder when you get the pain in the neck and shoulder. So you can just sit over here and straighten your back and then keep your hand over here on your legs and just you have to shrug your shoulder along like this and hold for 10 seconds. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Down. Again, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Okay, again, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. You have feel the contraction on your back? You feel the contraction? You feel the contraction on your back, like on your neck? Can you do the shrugging exercises? So have you placed your hand like this? Okay. Again, you can do it. You feel any contractions, any like tightening or something like that? No. Okay, no problem. So you can just, I will teach you again once. It happens because.
It's like a normal motion.
Normal motion. Okay. But you feel like sometimes contractions. When you do it for 3 times, you feel the contractions. This is also the motion exercises, range of motion exercises. If you can see here, this backward, this forward, this is rotation movement, and this side movement.
What is the in pair?
Yes. These are all the basic exercises when you get the neck pain. So whenever you feel the neck pain, you have to do this exercises. And if these exercises causes you like pain, increase in pain, just stop that only exercises. Don't stop all other exercises. So this is chain tucking, the best exercise for your forward neck and for your like other pain also. Whenever you drive, whenever you sit, whenever you do nothing, like you're just sitting, when you're watching television, when you're watching Netflix and all the thing, just put your fingers over here on your chin and then contract it inwards. When you contract inwards, then you have to like count for 10, 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. You do it for 3 times. Every exercise, 3 times repetitions and 3 times a day. Like when you type in the morning when you have to do 3 times, evening 3 times, and night 3 times. For a week you have to do it. Whatever you feel, just tell me in the mail. How do you like it? Like, do you feel any relaxation in your neck? Do you feel like it's okay? Whatever you feel like. Okay. So simple precautions that you can follow using good posture. When standing and sitting, be sure the shoulders are in straight line over your hips and ears are directly over your shoulders. Take frequent breaks. If you travel long distance or work long hours at your computer, get up, move around and stretch your neck and shoulders. When you work for a long time, like in computers, and you said you're working like for 8 hours, 12 hours, uh, take a break in between. Like when you work for 2 hours, if you can. Like I know there is some.
I know, I'm so sorry, but I think everybody knows about it. You know that earlier also the physiotherapist they told us, for every half an hour, just move a bit. It was just so busy. I'm so sorry with the deadline and all. Means what to say? You know the thing and it's very tough to apply on a daily basis. Means on professional life, to be honest.
But if you start with a new thing,
No, this is what I'm saying, doing. If I'm having any call or something, I'm saying, but when I just go, take a round, and then keep on calling the people, like, you just finish the things, do it little bit, you can do it for smartness, but every time it's not possible. Yeah.
but you can just, if you want to try new things, it takes time to like adapt it. So you can try it.
Sure.
Whenever like you're working for 2 hours, you're teaching your students just for 2 hours. You have taught them. You've done your work. Just stand up and move around. Do your stretching exercise that I told you. Some exercises that you can do. Do the exercises. Move. You can drink water because you have to complete your water target also. 4 liters. I know it's very difficult.
4 liters.
More than 4 liters.
We were ready. Yeah.
Okay.
What is this nice in this kind of heat and
Exactly. It is. I also think this 1 liter is going to finish actually.
yeah.
That's very good. If you are drinking the water,
We are drinking a lot of water. This is the problem.
because as you know that body is comprised of cold water, like more than percentage or only water. If you drink more water, the muscle will be less contracted and it will work more efficiently. So I know you drink more water, but try to take it daily basis. Because how it happens, like people drink 4 liters one day, second day, third day.
No, daily basis. This
Yeah.
is a daily basis.
Yes. Because the fourth day, fifth day, they drink 2 liters.
No.
Because if you are drinking 4 liters for 3 days, bodies adapt for like they become like 4 liters. A lot of people having cramp in their leg, in their hands, because of this. Body is giving them like hint that you are drinking less water. Please drink water. You feel cramp in your leg, you say, "Oh, I have a cramp." But the actual thing is, you drink water. That's a basic treatment for your cramps and all that stuff. So whenever you work for 2 hours, 3 hours, 4 hours, make a time. Like 2 hours, I will stand for like 10 minutes, 15 minutes. Give some time to you, to yourself. Drink water. Don't drink like chai and all caffeinated drinks because it can lead to decrease your water. But just walk, do some exercises, take water, and you can just do this for every 2 hours, 3 hours, 1 hour. It will help you. These things. So adjust your desk, chair, and computer so that monitors at eye level. I have told you like it should be eye level. Knee should be slightly lower than hips. Use your chair at armrest. Use it. Just use it. A lot of people don't use it, but you can use your table rest. You can do that. But try to do these things. I know it's not possible to do it every time, but you can try it because when you try, you can do it. When you say like we can try like 2-3 times, it will become a habit. And this is the last thing in that fourth point. Sorry. Okay. The fourth point is don't use more phones like this. A lot of people here in JGU use this kind of things.
I'm so sorry, but just try to understand. Who is not able to do that? Because we are not supposed to use
Yes, earphones.
earphones and all.
That I have made a point. Use a handset or
This is what it means. Otherwise, nobody's mouth and using means speaker.
Yes.
But
It's best
people are
to
there.
use your phone like this because your head is like this.
Because you are on with your laptop, it is okay. They tell me, okay, fine. Then I'm searching like what to do.
If you do like this, you're contracting this muscle, and this muscle is relaxed. This muscle is contracted. When you over with your phone like for half hour, 30 minutes, 20 minutes, 10 minutes, when you straight your neck, it is I have a pain, and you go to the therapist. Because this thing have pain. All the teachers, what the teachers do is when they use the chalk, they take their head off like this and then write. So that's bad. If you are using your body like this, it will create a pain. So it's better to use your phone like this and do like typing on this like. You can try new things. If you're doing like this things after this also, this class also, then it's bad. Because you're hurting yourself. Instead of getting a treatment, instead of getting relief from your neck pain, it's better to use your phone like this, or you can use like this and just do your work. You can just light it up like if you want to. But if you're doing like this, it's bad. Yeah, I know you cannot use earphone and all that because it's not allowed here.
No, actually, it's not look professional. That's the thing, right? Like everybody is having,
If you're alone, you can
gym
use
and
it.
all. It's okay if you're alone. So alone, I'm just using my speaker. Nobody's here. I can use
If you're
the
alone, you
speaker.
can use that lead.
No, not that much also. Speaker is also go again.
But if you're sitting like in the whole area and you're using your earphones, that look awkward. A lot of people think like that.
Yeah, everybody is just because of that.
So if you smoke, quit smoking. I'm not like telling you that quit smoking. It's your choice. If you smoke, quit smoking. That can put higher risk on a developing neck pain because when you just smoke, all that neck contracts. When you smoke, the muscle contracts and it can lead to muscle pain, body pain. Just don't do it. Avoid carrying heavy bags with straps over your shoulder. The weight can strain your neck. As I've said you, avoid it while you carry like this thing or this thing. You can carry like this.
I'm so sorry. I just want to ask one more question. I'm so sorry. I read somewhere related with all the research, different studies people. So you should not, use the back at your back. It should be in front.
Okay.
So this is what research studies said. That don't use the bag at back. It should be at the front. But it's very unusual because you're not able to just see, especially in the metros and all. You're able to see the people just because. But what is the best way to carry your stuff?
Best way to carry your bag, I think, that dual bag that MAP has.
No, we all think you're using that. That's okay. But this is what I want to ask you that. This is what the researchers said. Not at the back because it's having a spinal cord, right? So it's not good. So it should be on the front, at your chest side. It should not be from your shoulder. It's not good.
Don't carry high bag.
That's
Carry
fine.
a lighter bag.
That's fine, but it's not practically possible.
It is
You can carry two
It's
bags.
an advice.
You can carry two bags because if you're lifting heavy bag, because normally people don't do like this. Whenever you
Not talking about normal way. Means on daily basis they're having a laptop, a diary, basic stuff in our bag, right?
if you
Not
lift
that
anything
heavy.
from like ground, like okay, like from chair, you do like this contracted, then you lift it, you go off. Because a lot of people do like this. But I think you have to carry, if you can carry two bags, it's good. Handbags.
Okay, like
Not this type of
Like
bag
this,
because
okay.
what happens is that strap compresses the muscles. When it compresses the muscle, that in between the muscle is the nerves. The nerve compresses in the neck and then in the hands and in the tingling sensation will happen. The numbness will happen on your hands, on your shoulders. It will affect. It's better you can carry this bag because this bag is also not good because it also heavy. It's also heavy. It can lead to pain. It's better use handbags
okay, fine.
and lighter handbags. If you use heavy handbags, it can also lead to pain. I already told you if you want to lift anything you want because I cannot change everything.
Very
So the main thing is increase your muscle strength. If you increase your muscle strength, it will help you. If you like do this thing like if you take a lighter bag and go away, that's not possible in the daily life. You can what you can do is you can increase your strength. If you can increase your strength,
That is really useful. Right.
if you do exercises, strengthen your muscle, daily exercises, daily stretching exercises, you will never get a pain. Increase water intake, you will have a proper posture, you will never have a pain. If you like doing everything And if you also, if I say like do handbags, take handbags and all the things, fur pillows and all that, and then you will say, sir, pain is there because your posture is not good. We are doing above things like upper things. We're not doing other root things. Maintain your posture, drink water, strengthen your muscles, stretching exercises, do walk. That's the main thing. So doing these things can help. This thing can only happen when you do these things, and then you can progress on that.
Yeah, exactly. Then it
This is a
this is
modest
order.
Nice. So sleeping in a good position, your head and neck should be aligned with the body. Using a small pillow under the neck, try to sleep on your back with the thighs. Elevate on pillows which then flatten on your spinal muscles. So when you sleep, like I have told you like this, it get elevated. So use a thin pillow. If you use thin pillow, I know it's very difficult. Like you're using a bigger pillow, some people using bigger pillow, and some using a relatively thin pillow. It's better to decrease it day by day. And I will not say just go to home and buy a new pillow, thin pillow, and take it. No, that's not possible. So just the pillow you have, decrease that cotton or whatever that material is, and use it. It will help you. And stay hydrated. This are made up of mostly water, so staying well hydrated will help you for your neck pain. So my slide is all over. So these are the precautions you have to follow. Strengthen your bones, strengthen your like muscles. Every 1 year you have to take vitamin D calcium test done. Because what happens is, like in women and also in the men, what happens like when you're growing up at the age of 40, at the age of 35, 40, 45, the like calcium and other things goes down. So it's better to like check an investigation like vitamin D, calcium. It will help you. If it is less, it can also lead to neck pain. If you have a low calcium level, low vitamins, low other things, it can also lead to pain. Because body is made up of many things. Only one thing can affect your neck. So it's better to take care. I know it's very you have to do many things for my neck, but if you want to remove your pain, you have to do it. So just check up your back, strengthen your muscles, and drink more water. Stay like this muscle, this PPD I have told you all the precautions. I will mail all this PPD to you. You can check it once. And if you need any help from me in the next after this,
I think we should check the posture of ours.
Sure, I will check.
And
that.
what I was telling, because earlier there are other physiotherapists at this some
Sandeep,
yes.
Okay.
Sandeep Soni, right? So he used to just check with the fingers like this. Means he didn't used to keep us stand
Yes.
near the wall somewhere.
And
And say,
the
yes,
space.
yes, yes, yes.
Forward neck,
Yes,
forward
and forward neck. Is it that okay? You are in good posture.
I
You
have
are
told
in
you,
good
you
posture.
can-
Right.
Then you can check by yourself.
Yes.
If you cannot check, use a glass. First, but if you need any help from me, like after that this class, you can come visit our health center. We are there from 8 a.m. to 8 p.m. We are there all for you. No problem. No, don't worry for your pains. We are there to resolve it, and we are happy to resolve it actually.
Thank you.
Because a lot of patients come us and we want them to remove their pain. And I just want to say this, please do the exercises for at least for 1 week. Whatever you feel, just mail it to me. I will progress it. I will give you more exercises. Because these are basic exercises. Chair exercises, these are all chair exercises. You don't have to stand, sit, or like you have to like other devices you want, or like other muscle equipments, all that stuff. You don't want it. Just hands and your neck and you. That's it. So try it at least for a week, mail to me, whatever, if you feel pain or whatever you think. And if you want to get more exercises from me, you can come to me whenever you want in the health center. We will just perform outside. I hope you get fitter more and neck pain won't be coming.
And actually, these kind of sessions are really required because we know and we are not able to follow that and we skip a lot of things. We're trying actually.
Yeah.
Thank
So
you
I will
so
try and
much.
make
Yeah.
another session for back pain. I'm trying for back pain, no back pain because you have. So
A lot of people have actually.
Yes.
People are not going to say many people.
I don't have neck pain, I have back
Back pain.
No, I am not having any kind of pain, but few days back, I'm not able to sleep properly or what happened, something. That's the reason why I'm having a back pain. Otherwise, just doing yoga on a daily basis is really helpful.
So doing yoga on a good posture will also help you.
Yeah, because
Don't
I'm
forget
doing
about-
from lot means from earlier ages I'm just doing it.
Okay.
In school time actually,
Okay.
and then here I just joined the gyms.
That's good. So I will take another class for you for back pain. It will help you for sure because I will teach you some exercises.
as well as
Yeah, sure. No problem. No problem. So over there, we'll teach you some exercises like here. It will help you for like strengthening muscles, stretching exercises, range of motion exercises. This exercise is for your neck. If you don't have pain, you can use exercises for strengthening also. I know a lot of people don't have neck pain like this kind of, but they can use this exercises for like this improving their muscles quality.
and not wait till the pain starts.
Yes.
Yes, exactly.
And go get a checkup for vitamin D and all that. It will help.
And especially you don't have right now, that's what you shouldn't have later on also. But it happens like if you're just stretching your hours like 16, 17 hours, 18 hours, it happens, right? For a week or something, then you feel that. So that is it. And the worst part is once we are working at home on our bed with the pillow and all. Sure. Thank you.
So you can write anything you want. It will help you for me because this is my first workshop
Oh no, it's really awesome. Seriously, it's really good.
and it will help me. For this feedback will help me. I will improve myself again because in JGU it's been 1 year for me and it's a new workshop for me. And I hope if I can, I will do the exercises. So this is the exercises you can do at home. It will help you. You have that exercises. At least do it for a week. It will help. And you can visit our health center whenever you feel pain, or if you don't have a pain, you can also visit them. Okay. We'll do another session of low back pain. Yes. Yes.
So, like I started my everything was started. Still, after the exams and also my grades are great. So, when it's just simple exercise, even as very when they are sitting in the lower levels. So, literally, I do a lot of it. I'm not able to start. I increase my intake after the medicine.
So, how much?
I already added the half liter extra.
Chair or something, soft chair. You're sitting on a chair. You have to be like, keep your legs over.
Is the so right now there is so I'm using below and I'm taking below my knee. Apart from it, there is no section. So I'm doing that.
I will teach you some exercises.
Yes.
We need some more motivation. Sure.
Sure. I will take another class of low writing because
he being in sports,
Yes.
an old international player.
Oh,
So now it is really down. Working hard is so much. So wanted to do all those things, but
so uncle, please do that exercises.
yeah, definitely this will help. I know this will help.
And you really
Sir is also doing exercises. I know.
This refreshes of you. This is always good. Thank you so much.
Thank you so much.
Okay.
It has been great pleasure to be here.
Thank you. Thank you very much. So you can come to our health center. I will teach you some things over there. If you want to go, I can teach you.
seriously, I don't have any comment.
Okay, I will teach you. No problem.
Right now,
Yes. No problem. I can teach you.
today I will not take your test.
Okay. You can come
Yeah,
now also.
I will not.
You can come now also. I'm there. Just for a
Sorry for this.
program. I'm there.
Your health should be more important than how it looks.
Very true. I am always going to gym. Not to catch shrimp. I always need, if you are having burpee, whatever what, but you should be active. Yeah, use those things. But
it's considered natural.
Distraction now. Students are going.
Oh,
Like,
okay,
no,
okay.
like how music.
नहीं, अगर students के साथ
ज़्यादा
ज़्यादा
interaction
interaction
होता है,
होता है,
that is the thing.
normally
Exactly. You need to be, because if I'm just saying something to them, I have to follow that
maybe तो
first.
students के सामने नहीं
थोड़ा सा
obviously, हाँ.
नहीं, इसी वजह से like ना work करो तो मेरा तो बहुत ही okay, I know it's not a good sign, like yeah वहाँ पर वो
This kind of a work life, this is not how we are meant to live.
exactly
Yes, so
very true.
to some extent हम बहुत कुछ कर सकते हैं, but the way
But sometimes what I feel we are responsible. We are, this is all the excuses, many times I should say. This is kind of a rule. It's a kind of undiagnosed. I'm not going to do that, sorry. Because school paid had one like this, right? So I think it's also kind of excuses. Because जब तक आपकी body छेड़ती है, आप जुड़ा रहे हो. Like that's the basic approach.
Which is ignorance of it.
Yeah, exactly. Many times this happens, and we are giving the kind of excuses. This is the reality. This is really nice one. What's your good name?
Siddhi.
Siddhi. Sorry. You doing